You left the appointment with answers. At least that's what the chart says. The visit happened. The doctor explained the diagnosis. The recommendations were made. The notes were documented. The appointment was technically successful. Then why did you sit in your car afterward feeling completely alone? Why did you replay the conversation on the drive home? Why did you suddenly think of 5 questions you wish you had asked? Why did you leave with information but no understanding? Many of us patients assume that feeling dismissed means a doctor ignored them. And I don't think that's always true. I believe that one of the biggest misconceptions in healthcare is that we patients often feel dismissed when doctors don't care. Many of us patients feel dismissed by providers who care deeply. The problem is that caring and communicating are not the same thing. A physician can answer your question without understanding what you're really asking. A physician can also explain a diagnosis without making sure you understand it. And a physician can spend 30 minutes with you and you can still walk away feeling unheard. And that distinction matters because if you ever left an appointment feeling confused or overwhelmed or intimidated, rushed or uncertain, there is a good chance you were ignored. You were just never truly understood. So today, I'm going to talk to you about how to change that. And it's not through confrontation or arguments or becoming a difficult patient. I'm going to talk to you about how to advocate for yourself in a way that is respectful, collaborative, and effective because your voice matters, your questions matter, and your understanding matters. Nobody should have to leave a medical appointment carrying confusion alone. So, I want to share something personal. When I look back over my healthcare journey from the lupus nephritis to chronic kidney disease and dialysis and transplantation, rejection episodes and hospitalizations, biopsies and medications, and countless appointments, including lab work, I can identify many moments where information was given to me. What I cannot always identify are moments where understanding was confirmed. You know, nobody intentionally harmed me or ignored me. Um, I would say that my providers were often clinically excellent, and some were compassionate, and many genuinely actually cared. Yet, I still remember walking out of appointments wondering, wait a minute, what exactly does that mean? Or what happens next? Should I be worried? How does this affect my future? And looking back, there were times I nodded when I should have asked another question. And there were times where I said, okay, when I was still confused. And, there were times that I accepted explanations that I did not fully understand because I didn't want to slow things down or I don't want to seem difficult or take up too much time or inconvenience anyone. But the irony is, it's my health. And that's the one area where I should have felt most comfortable asking questions. And many of us patients recognize this feeling. You sit in a room, your doctor is speaking, the clock is ticking, and you sense they have somewhere else to be, normally another patient. And so you begin editing your own questions before they leave your mouth, and you prioritize their schedule over your understanding. It happens every day. And, you know, many of us assume that self advocacy is easy, and it's not. And it's not easy when we're scared or you're receiving life changing information, especially when you're discussing something along the lines of, let's say, cancer or transplantation, surgery, autoimmune diseases, abnormal test results, chronic illness, and I want to add that fear changes how we process information, and stress changes memory, and anxiety narrows attention. And what most of us don't realize is that patients frequently remember less than half of what is discussed during a medical appointment. And it's not about being careless, we're human. And so when emotions run high, comprehension drops. And then another factor enters the room, the power dynamics. These doctors have years of training, and you know that. And you assume, okay, they must know best because they're the expert. And I don't want to challenge them. Sure, respect is important, but blind silence is not. And there is a difference between respecting expertise and abandoning your own voice. So let's define the phrase pushing back. And when you hear those words, you think about conflict, right? That's not what I'm discussing with you. Pushing back in this case means protecting your understanding. Pushing back means slowing the conversations down enough to participate in it. Pushing back means saying, I need more clarity. I need more context. I need another explanation. I need a moment. And that's not confrontation, that's communication. And a healthy healthcare relationship should make room for questions, and it should welcome clarification, and it should not punish curiosity. All right, so now let's identify 5 phrases that change everything. Phrase one: can you explain that another way? It's simple, it's respectful, it's powerful. Phrase two: can you help me understand what this means for me specifically? Keep in mind that medical information often arrives in generalities. Patients need personalization. Phrase three: before we move on, I want to make sure I understand. And that phrase immediately slows the pace. Phrase four: what concerns you most about this result? That phrase actually reveals what actually matters clinically. And then lastly, phrase five: what would you do if you were in my position? I think that's one of the most revealing questions that you can ask. So, I want to discuss some questions that I wish I had asked sooner. All right. And some of those questions include, what happens if we do nothing? Or what are the alternatives? And how would, what would make you change your recommendation? Or what should I watch for? And my favorite, how urgent is this? And is there another explanation? And then lastly, what are the risks and the benefits? And these examples of questions create better conversations. All right. And so now let's talk about when you need a second opinion. Now, keep in mind that a second opinion is not betrayal, it's not disloyalty, and it's not accusing your doctor of being wrong. It's information gathering. And the best physicians understand this, and many encourage it. All right. So just consider this: you can respect your physician and still seek another perspective. Both things can be true. Now, not every provider is the right fit because communication matters, trust matters, and feeling safe enough to ask questions matter. So, if you're consistently leaving your appointments feeling unheard or dismissed, rushed, discouraged, I want you to pay attention to that because patterns matter. And there was a period in my life when healthcare felt like a full time job. I was managing my autoimmune conditions and then ultimately dialysis and transplantation. And each and every one of those appointments brought new information, and every lab report brought new questions. And every specialist seemed to have one piece of the puzzle, but nobody was helping me connect the dots. And ultimately, I became responsible for understanding medications I could barely pronounce, but I'm better at it now. And anyways, lab results that seem impossible to interpret, and let's not even discuss the insurance paperwork and the treatment decisions and the follow-up appointments and questions that often surface long after I had already left the doctor's office. And what I needed was not another diagnosis, but what I needed was clarity. And I needed a way to better understand what was happening inside my own body. And I needed a place where I could slow down, review information, and prepare conversations with my healthcare team. And that need is what eventually led me to build Albora Health. And it's not because I wanted to replace doctors, and it's not because I thought technology had all of the answers. It's because I know what it feels like to leave an appointment with information but still feel confused. And I know what it feels like to stare at a lab report and wonder what matters and what doesn't. And I also know what it feels like to carry healthcare questions home with you. And Alvora Health was built to help bridge that gap and to help you understand and to help you prepare and to help you participate more confidently in your care. Because better understanding your health, because understanding your health, sorry, understanding your health should not require a medical degree. And you're not difficult for asking questions or wanting clarity, and you're not challenging authority by seeking understanding. You are a participant in your own healthcare. And many of us spend years believing that we need permission to speak up, and you don't, because your questions belong in a room and your concerns belong in a room, as well as your confusion and your voice, because better healthcare begins when you stop feeling like a spectator and you start feeling like a participant. And remember that better clarity leads to better understanding.